Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. Today on the VEC Vaccine Notes, we're going to be focusing on polio. We'll talk about the virus, the vaccines that prevent it. We'll address some common questions we receive here at the Vaccine Education Center, and we'll talk about the relative risks and benefits. Probably the most famous person to have had polio was Franklin Delano Roosevelt. He got polio in his late 30s and remained confined to a wheelchair, although most of the time people did not see him in a wheelchair when he was president because he didn't want the focus to be on his disabilities. When people had polio, paralytic polio, they often stayed in a wheelchair or could be confined to iron lungs for the rest of their lives. Iron lungs were negative pressure ventilation units that people would use once their muscles to help them breathe were paralyzed from the infection. Pictures from the 1950s show rows and rows of children in iron lungs. Polio is caused by a virus. There are 3 types of poliovirus, labeled 1, 2, and 3. 2 of the 3 types have been eradicated, which means completely eliminated from the world. Type 2 was eradicated in 1999, and Type 3 was eradicated in 2020. There are groups throughout the world that are working hard to eliminate the last cases of polio. Now, the United States eliminated polio in 1979, but 2 countries have never eliminated polio. And right now it's May of 2025, and Afghanistan and Pakistan continue to have wild-type polio cases. In other countries where outbreaks occur, it's most often with vaccine-derived virus, and we'll talk about why that happens a little bit later. First, let's talk about what happens when someone gets polio. Polio is highly contagious, and somebody infected with polio can experience one of 4 outcomes. Most people, about 72 of every 100, probably won't even know they were infected. They don't even have any symptoms. About 24 of every 100 will have mild symptoms. They'll have a sore throat, a fever, vomiting, constipation, stomach pains, things of that nature. About 4 of every 100 will have what's called non-paralytic polio. So they'll experience those minor symptoms that we just described. And then they'll also develop meningitis, which is an inflammation of the brain and spinal cord. When that happens, they'll also have more severe symptoms related to fever and pain and headache. But what scared most parents in the 50s, before there was a vaccine for polio, was what can happen in the 4th case. This happened very rarely, but it was paralytic polio. And this would cause muscle spasms, pain, and paralysis. And this was the version that would cause people to die. Now, the rates of paralytic polio that occurred varied based on the type of polio someone had. Type 1 caused the most paralysis, and type 2 the least. But all 3 types of polio can result in paralysis. There's another important point about polio disease. As people who survived the polio epidemics of the 1950s have aged, we've learned about what's called post-polio syndrome. These individuals have developed muscle weakness and fatigue, reminiscent of their symptoms when they had polio as children. It's not completely understood why post-polio syndrome develops, but it's anticipated that it relates to nerve damage that was done during their initial infection, as well as aging of the immune system that allows for these symptoms to reappear. So let's shift gears and talk about the vaccines. In the United States today, we use 1 polio vaccine. It's called the inactivated polio vaccine, or IPV for short. Infants receive 4 doses, 1 at 2 months, 1 at 4 months, 1 between 16 and 18 months of age, and then another dose between 4 and 6 years of age. Inactivated polio vaccine was developed in the mid-1950s, in 1955 specifically, but it really wasn't used from the 1960s through the 1990s in the United States. And we'll talk more about why when we talk about the second vaccine. But to finish our discussion of IPV, since the year 2000, children in the United States have been recommended to receive 4 doses of IPV. That vaccine is given as a shot, and it's made by taking poliovirus and inactivating it with a chemical so that it can't possibly cause an infection. When the vaccine is given, antibodies develop in the bloodstream. And so if a person is infected, once the virus reaches the bloodstream, the antibodies will stop the infection and prevent it from going into the nervous system and replicating, so it can't cause paralysis. The inactivated polio vaccine is very safe. At most, it causes fever and injection site pain. In about 1 of every 1 million children, it could cause an allergic reaction, much like any vaccine. So the recommendation is to stay at the doctor's office for 15 to 30 minutes after getting vaccines. And that way, if an allergic reaction develops, it can be treated medically and it doesn't cause any lasting effects. The second type of polio vaccine is called the oral polio vaccine, or OPV. OPV uses live weakened polioviruses. The viruses are weakened in the lab by growing them in cells that are different from the types of cells that they grow in our bodies. When polio vaccine infects us, it infects our cells of our intestine and our brain and spinal cord. So in the lab, scientists grew the vaccine virus in monkey kidney cells. And as the virus got better at growing in those monkey kidney cells, it got less good at growing in our human cells. So when somebody gets the oral polio vaccine, although the virus replicates to produce immunity, it doesn't replicate as efficiently as it would during an infection. Now, this difference of having the virus replicate to generate immunity causes differences between OPV and IPV, and it relates to why the vaccines were used differently throughout the world over the course of the years since those vaccines became available. OPV became available in the early 1960s and was better at stopping the spread of polio. So why is that? When the vaccine is given as the oral vaccine, the virus actually replicates in the intestine. This means that many antibodies are present at the intestinal surface. And so when somebody's later exposed to polio, the virus is stopped at the intestinal surface rather than stopped in the bloodstream, which is what happens after IPV. Now, the benefit of that is twofold. For the person, they have better immunity because they don't get an infection at their intestinal surface. But it also means that they aren't as likely to transmit the virus to other people if they're exposed because it doesn't replicate in their intestine. It's stopped. Now, the good thing is that, and if you'll bear with me, gets complicated, but I think we can do it. Because the vaccine virus replicates at the intestinal surface, people who got vaccinated recently can spread the vaccine virus. And that actually helped to stop transmission of the virus, particularly in parts of the world where it was difficult to vaccinate everybody. When people who were vaccinated shed the virus and other people were exposed to the virus, they too could develop immunity. This is a concept called contact immunity. And again, it helped us to eliminate the virus from many countries throughout the world. Now, you might be wondering, if oral polio vaccine provides better immunity to the person who got vaccinated, and it helps us decrease the spread of the virus, then why did the United States switch to using the inactivated polio vaccine? And that's because the oral polio vaccine has one really big drawback. Sometimes the weakened virus can mutate and actually become more like the wild type virus and cause paralytic polio. This happens very, very infrequently, about 1 in every 2.4 million doses, but it's a real and severe side effect of the oral polio vaccine. So by the 1990s, the only people getting polio in the United States were people who were getting it from the vaccine virus, either because the virus mutated in the vaccine recipient and caused them to become paralyzed, or because the weakened virus spread to somebody else and caused paralysis in that person who was exposed through the community. So to eliminate that severe side effect, in the late 1990s, the United States switched to using the inactivated polio vaccine. Okay, let's talk about some of the common questions we receive at the Vaccine Education Center related to polio and the vaccines. First, sometimes people wonder why we use IPV when they know that other countries use OPV. And we talked about this in relation to the side effect of paralysis that can be caused if the virus in OPV mutates back to the wild type. When people develop paralysis as a result of exposure to vaccine virus that reverted, it's called vaccine-associated paralytic polio, or VAPP. If you want more details about VAPP, or just to read through the differences between IPV and OPV, definitely check our polio webpage at vaccine.chop.edu. We also get questions about whether adults ever need a polio vaccine. If you're an adult who knows you didn't receive the doses as a child, or you only received part of the doses as a child, you should complete the vaccine series. If you received all of the doses as a child, but you find yourself in a high-risk situation, such as during an outbreak, or because you're traveling to a place where polio is occurring, you can receive one lifetime booster dose. Another question we get sometimes is if polio only exists in two countries, Afghanistan and Pakistan, why do we still hear about outbreaks in other countries? And this is because of the vaccine virus causing outbreaks in some of those other places. There's a group working towards polio eradication known as the Global Polio Eradication Initiative, or GPEI, and they put together a weekly report for cases, either wild type or outbreak associated cases related to the vaccine viruses each week. And if you go to our webpage and you look for this question in the other questions you may ask section, you'll find a link to their website so that you can check the weekly cases throughout the world. In 2022, media reports surfaced about a man in New York who became paralyzed by polio. This made people wonder what happened, what were the details of that, and what does it mean for us in the United States? Polio likely comes into this country regularly. We just don't know it because we have high immunization rates. In the case of the man in New York, he was unvaccinated, and the type of polio that he had paralyzes about 1 in 2,000 people who get that type of polio. So that case really serves as a wake-up call for us in the United States, because it likely means that there were many other people exposed to and infected with polio virus, and we weren't aware of it because only one man became paralyzed. This reminds us why we need to keep our immunization rates high. We have a video on our website where Dr. Offit, our director, discusses that case in 2022 and provides more details around the context of the case as well as what it means if you're interested in more details. So let's wrap up by talking about the relative benefits and risks of polio disease and vaccination. Today we talked about the fact that polio was eliminated from the United States in 1979. And 2 of the 3 types have been eradicated or eliminated from throughout the world. But we also talked about the fact that 2 countries, Afghanistan and Pakistan, have never been able to eliminate wild-type polio, and that we still see outbreaks of polio in other countries that use the oral polio vaccine, or OPV. As long as we're continuing to see cases of polio in other parts of the world, people in the United States remain at risk of polio entering this country and infecting people who are susceptible. We had a wake-up call in 2022 when an unvaccinated young man developed paralytic polio, and it reminded us that likely many more people in the United States had been infected with that virus, but we just didn't know it because they didn't develop paralysis. The different types of polio cause different rates of paralysis, but all can cause paralytic polio and death. We also talked about the fact that people who survive polio as children can go on to develop post-polio syndrome, where they again experience muscle weakness and fatigue years after they recovered from the original infection. On the other hand, in the United States, we use IPV, or inactivated polio vaccine. The side effects are minimal, if at all, and that they can include a fever or soreness at the injection site. As with any vaccine, A rare chance for an allergic reaction can occur, but occurs at a rate of about 1 in 1 million. So by staying at the provider's office for 15 to 30 minutes after getting vaccinated, you can be sure that the healthcare personnel would be prepared to take care of an allergic reaction should it occur. When our team evaluated the risks and benefits of polio vaccine, we determined that polio vaccination is the safer choice, and we hope you'll determine that as well. Thanks for listening today.